Good morning, everyone. My name is Barry Burton. I'm the Pinellas County Administrator. I'm very happy to invite you here to our Largo location for our largest vaccination site. Today it's fully open, and at this site it gives us the capacity to be able to do 2,000 vaccines a day. This is by far our largest site, but what it really does is creates the ability to contract or expand based upon the vaccine supply. I want to reiterate that this is a partnership between the Florida Department of Health, our Pinellas Fire Paramedics, Department of Health nurses, along with county staff. You have to have an appointment at the site, and as we've said before, if you are in need of a vaccine, register at our site. Dr. Cho and some others are going to talk about the different distribution channels that people can go about in order to receive a vaccine. We are one of those distribution channels. Register at patientporterfl.com and you'll be invited into our site for an appointment. So I know we had some issues with everybody having to go into a site at a certain time. Well, that's changed around now. If you're registered, as we have appointments available, you'll be invited to come and fill one of those appointments on a first come, first served basis. As you know, there are many other distribution channels, including Publix, Sam's Club, and Walmart. As they come online, each of them have their own registration process. I'd like to now turn it over to Dr. Cho, the Director of the Florida Department of Health, and for a few additional comments.
Hey, good morning, everybody. I'm Dr. Yuli Cho, Director of the Florida Department of Health in Pinellas County. Just to give a little update in terms of some of the successes, some of our numbers to date. As a community, we have vaccinated close to 109,000 individuals, at least receiving a first dose of the vaccine, over 77,000 of which have been over the age of 65. Keeping in mind that with the governor's executive order, our main priority groups right now are the 65 plus, the healthcare workers, and long-term care residents and staff. One of the other achievements through our pilot program, through working with the fire paramedics, has been really getting the vaccines into the long-term care facilities. As of this morning, we have vaccinated a total of 9,900 long-term care residents, which by total number is the highest in the state. And that's especially important given the fact of the burden of disease we saw in those facilities. Right now, 60% of our deaths have come from these long-term care facilities, unfortunately. And in the height of the pandemic, it was as high as 70%. So really getting the vaccine into this vulnerable group has been a huge accomplishment. And as Barry mentioned, I think the beauty of having a site like this is that ability to expand and contract based on vaccine availability. And at the same time, we can simultaneously do first and second dosing, keeping in mind the 2 vaccines out there requires the second dose. So at our other 4 community sites, we're doing 10,000 this week, and at this site, 9,000 this week as well. So 19,000 vaccines at a community pod site is a huge deal, and I'm really proud of the work and the partnership of all our community partners here. But again, this is just one part of the puzzle, right? There's other places you can get the vaccines. The pharmacies are expanding. All 42 of our public sites are now offering vaccines, again, based on their availability. Sam's Club and Walmart's, we have 6 locations total also offering vaccines to our Pinellas County residents. And I'd like to see in the future more distribution sites to the hospitals, to medical clinics, and just continue to expand, because as we get into the general population, I think we will need more and more of those sites to really get all the shots in the arms as fast as we can and most efficiently as we can. Health equity has also been a big focus of ours. We understand and appreciate that the disparity in our communities of color. And to that end, we've put together a work group with community leaders. We've worked with faith-based communities. We've done church missions to get the vaccines out to those churches and organizations that serve communities of color. So we'll continue all these efforts as we have our goal to really get the shots in the arms. And again, I thank you all, and I thank the partnership and everyone's hard work.
And I'm Chief Bars with Treasure Island Fire Rescue. I've been asked by the county to coordinate the site. I just wanted to take a few minutes to say how appreciative we are of how this came together and all the work. 8 different county agencies, our Sunstar ambulance provider, 18 fire and EMS agencies here in the county, and Department of Health have all partnered to staff this site, to get it up and running and maintain it at the capacity it has. We anticipate doing 2,000 doses a day the rest of the week this week. That's running 8 lanes on 2 different sides. We do have the capacity to run 12 lanes if and when we get the vaccines coming to us. So this is a great opportunity for the citizens of Pinellas County to get their vaccines, and we're just happy to be a part of it. Thank you. Commissioner?
Thanks. Good morning. My name is Dave Eggers. I'm the chairman of the Board of County Commissioners here, and I guess more than anything I would say a couple things. One is thank you for the partnerships that we have. It just couldn't happen without them, and our staff and the nurses and the paramedics all working together to get shots in arms. For me, it's also about less anxiety for our residents, because it's one thing to have the vaccines, it's another thing to have a system that creates more anxiety almost in getting the shot itself. And so in the last week or two, there's been a process that we've gone through to develop a system. So it's all important. Register, get registered, so that you're in the system. Once we get the amount of vaccines that are coming in, we reach out to the residents and invite them to call in and make their appointment. So we're having maybe 10,000 that are calling in and not 200,000, overburdening the lines and creating a lot of anxiety. So that's been a great improvement. One of the issues that we have is now we're sending out the invitations and getting people to call in and get their appointments. You know, people have been wanting to do that, and they're either not getting the message, they found another place to get the vaccine, or they need a call and not an email, because a lot of folks that we're dealing with right now don't have access to emails and computers and that kind of thing. It's about phone calls. So we continue to work on the system to make sure that folks are calling in and getting their appointment. And so we're working real hard to do that. But all in all, I'm just really glad this site is up and running. We've had a lot of people say that it works smoothly to get signed in, and it's worked smoothly once they've been here. Both equally important. So really encouraged. I think that's the word of the day for me, is encouraged that we've made some really good progress in making people feel better and get their vaccine. So anyway, that's what I have today. Anything else, Barry?
We'll just open it up for any questions that you have.
I was going to say, you said this is the largest vaccination site in the county. Is that correct?
That's correct.
So how will this, I don't know if this is best for you to answer, or maybe Dr. Cho, how is this going to make the distribution process better for Pinellas County residents, that you have that ability to either expand or condense it down based on the availability of the vaccine?
Well, if you think about it, our fire paramedics are doing this on an overtime basis. They have a job, now they're doing this in addition to their job. Well, at other sites, when they were doing shots for 3 weeks, now they're doing second shots for the next 3 weeks. So we have to have the ability to have other sites to be able to do first shots, and we need the capacity to be able to put the throughput to be able to distribute the vaccine that we receive.
It's already kind of a system that, as we saw over the past few weeks before now, was taxed with registration, and there's been relief with that. How much relief is it providing that these other locations outside of your guys' control, like the Walmart, Publix,
right,
how much is that helping to alleviate some of the burden on your guys' systems?
Well, it's relieving some, and it depends on the amount of vaccine that they receive. And so, the biggest issue obviously is the supply side, and that's a national issue. And so, but the more opportunities we have for people, it just makes it easier. If we have 48 locations of Publix, well, then that's 48 more people that are putting shots in arms. And that's how the flu shot works. You have many different ways in which you can get a flu shot. Right now, though, everybody needs it, and so obviously there's a pent-up demand.
There were a lot of lines on the other side of the bay, like at University Mall. We saw huge amounts of traffic. Is there anything that you guys are doing here to cut back on those large lines? And did all these people, get exempted because they had already pre-registered for the vaccine?
Well, I don't know about I did see the lines on TV, but I think one of the things you're seeing here is by having many distribution sites, 5 now, that, it kind of dissipates the crowds. What you're seeing here is people, wanting to get their vaccine, so they're showing up early. They don't need to, but they are, because they want to make sure they have their spot in line, and so that creates some lines, but it's certainly not to the volume you've seen other places. I think people to remember, we're signing people up into a slot, and these are people that are pre-registered. They received an email. It said, you've got 48 hours to come online with this code and be able to secure a spot in line. And so it's based upon that they're in line today. We'll continue to use that process. We also know that there are people that are registering by phone and other means, and we're refining those processes as well.
Doctor, could I have you step up and it might be a little premature, but obviously with the variant, there may be additional shots required. Can you just comment on the fact that, what a rollout has been with the first 2 shots? Are there plans in the works that if that becomes a reality, what we do about that?
Yeah, so it may be a little premature to speak on the various variants and how they impact vaccines. Obviously a lot of research. In terms of longevity, that's another question with the vaccine. I think that we'll know in months to come. Keeping in mind, I think the science of COVID has been changing on a near daily basis. What we're doing in terms of the variants is that we are at the state level doing surveillance, doing gene sequencing to see what kind of variants we're getting. I thought I saw a report out of Miami got the first case of a Brazilian strain, so there are some data that shows that there may be some decreased efficacy or effectiveness with the vaccine. So it's something that we're monitoring. And as to the further recommendations in terms of boosters, in terms of the ways we need to ramp up the vaccine, is to be determined at this time.
Any other questions?
Any other questions?